We are ready to go. And I would like to welcome everyone to today's meeting. This is an open session in which we will discuss the questions related to the committee's task that we posed recently to the USDA. And in accord with this being an open meeting, I will read you the chair's statement. As chair of this committee and of this committee meeting, I'd like to welcome everyone. The task being undertaken by this committee for the National Academies to review the 2020 to 25 dietary edition of the Dietary Guidelines for Americans and conduct a comparative analysis. And our task is first to analyze the scientific methodologies, review protocols, and evaluation processes used to develop the most recently issued guideline, compared to recommendations included in the 2017 report from the National Academies, titled The Redesigning of the Process for Establishing the Dietary Guidelines for Americans. We are also going to evaluate the scientific studies used to develop such guidelines to determine the needs of Americans with diet-related metabolic diseases compared to the most current and rigorous scientific studies on diet and diet-related metabolic diseases. And our third task is to evaluate how implementation of the recommendations would have affected the most recently issued guidelines. In addition, I'd like to note that this is an open on-the-record session. Interested individuals have been invited to attend as observers, and we will not be entertaining questions from the floor. I'd like to welcome all of those whose many names I see on my screen as joining our program today. I would also like to remind everyone that this is an information gathering session. That is, the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and not recommendations in this report. Therefore, I will ask everyone here today to be mindful of the fact that the committee has made no conclusions and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as the position of the committee or of the National Academies. In addition, committee members typically ask probing questions in these information gathering sessions that may or may not be indicative of their personal views. The committee will deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee, and the committee must then respond to this review with appropriate revisions that adequately satisfy the Academy's Report Review Committee and the chair of the National Research Council before it is considered a National Research Council report. And with that, I would like to welcome three of our sponsors. Dr. Eve Studi, representing the Department of Agriculture, Dr. Julie Iobagi, also representing the Department of Agriculture, and Janet DeJesus, representing the Department of Health and Human Services. We greatly appreciate your coming to join us today. We know this has been on short notice, and we also really appreciate the material that you provided us in advance that will reduce the number of questions you will have to answer today by a considerable amount, which I suppose was the point of it. I think it would be probably most useful and clear both to the committee and our guests if we used the questions that Dr. Yakhtin posed to our guests as our framework for asking questions, because in many cases you have responded with sufficient clarity that there probably isn't another question right yet, because they came in a timely manner from you, but not quite enough time for us to digest fully what's there. And so I will lead the discussion through the questions. I would greatly appreciate it if the committee members would chime in anytime you have something you want to ask that's in addition to what's here. And Dr. Studi, there are a number of cases where you said to be sent separately, and we appreciate that not everything was ready. But when we get to that point, if you can give us some sense of the kind of material that you're planning to provide and when we might see it, because as you know, we have a two-stage process, and trying to figure out which is in the first and which is in the second stage would be helpful to everyone. Okay, we ready to go? All right. The first question was to identify related to identifying the milestones in the DGA process. What was the initial plan, and then what was the plan that was executed. And this is something that Dr. Studi has told us will be sent separately. So are there any hints as to what you're going to provide us and when?
Sure, thanks. And I'll say the response was a joint response across many people, but this one, we have, I think this sounds good. We can give you a sense for kind of what we're working on, and if you can let us know if there's additional things you'd like us to integrate into that.
Mm-hmm.
We have a high-level comparison of milestones over the last few editions of the dietary guidelines.
Mm-hmm.
And we've added the 2020 process to that high-level milestones. And we have a document where we have each of the 7 recommendations that were included in that second report in a response as to how USDA and HHS addressed that recommendation in the 2020 process.
That's terrific. It's harder to work this out from the outside, let me tell you, because we're trying.
I can't even imagine. So I do appreciate that. So in terms of timeline, I'll say just as for all of these, we were able to turn around the ones we're in a pretty good place, I think, with these generally. We were able to turn around the ones we could get to you quickly because that information was easily linkable. These other ones, though, I mean, I would think it's probably a week. We could probably have them turned around. There's a few things we need to just wrap up. And then just with anything, we have to run it through a few different people before we can send it outside of the departments. Mm-hmm. But I would hope probably in about a week, we should be able to send that. But that's kind of what we're thinking, just a comparison of the milestones over time and literally the 7 recommendations and the response, kind of how the departments integrated those in the 2020 process.
Mm-hmm. That's exactly what we're looking for.
Okay, perfect.
And Monday's a holiday, so give yourself a little wiggle room there.
Deal.
Right. Our second question were, how were the DGA topics selected following the public comment period? And you have provided us a range of links to the DGAC report, to videos and slides from various committee meetings. And I think we will just move on unless there is a question from a committee member at this juncture, recognizing we have not reviewed these thoroughly yet.
And actually, maybe if you don't mind, I'll give a little context there. Sure. So as you'll note in what we sent, this is kind of, there's kind of multiple elements to this. So we have, we went through a topic identification process with the departments with federal staff from USDA and HHS, as well as some additional input from a few other departments. That also included a public comment period. That's the first set of links, but we've kind of been in this, we've been working on identifying topics and questions for Bertha 24 in particular for a number of years. We did a topic identification process for that in 2012, 2013. And those links, as well as related publications, are provided there. So there are a couple of different elements to it. You'll see a lot of similarities in the process, in the criteria that we've used throughout those processes. But one of the things that we'll also work on, which is, I think, part of this 2A, is a list of the questions that were addressed by the 2020 committee and where they came from. So that came from the B24 topic identification process, or that came from the Pregnancy and Birth of 24 Months project. We call them technical expert collaboratives versus the TEP. But so we'll do a bit of, just kind of say this one came through the federal topic identification process. This one was refined following public comment. So we'll do the list of 2020 committee questions and kind of their root source, I guess.
The one that is of particular interest to me is the lactation questions, which were created by the B24 process, but then not part of the federal legislation. And they weren't part of, as I recall, what you were asking for when you searched for committee members. And yet they did make it into the process, thank goodness.
They were identified, they weren't part of the PB24 project, but we did have them as part of our topic identification process with the federal government and the public comment. So they were part of that piece. But yeah, we'll definitely.
It was part of the early part because two of the committee members, myself and Emily Oken, were the co-chairs of the group that considered lactation.
Yes.
Just these are the kinds of things where we'd like to sort of corral all the pieces so we can actually understand, because there were various methods, which was which. I don't know that it's a problem that were various methods. You would expect them to arise, these topics to arise by various methods. But so there's a piece there that will be sent separately. We had questions about health outcomes that you have answered. We have another question about how was chronic disease approached? Was it considered from a risk of disease or a disease state perspective? And you have provided us with some answers about this. That's part of our second task, which focuses on chronic disease. Are there questions from the committee about the chronic disease part of this?
Can I ask a question here?
Sure, Emily.
This is Emily. Hi. So I just have seen a few different, I've just seen it described in a few different ways. So in some places they talk about including people at risk for chronic disease, and in other places I've seen it described as including individuals with disease. And I wonder if you could just speak a little more about that.
Sure. Hi, Emily. This is Julia Baggy.
Yeah.
So the criteria that we apply in our systematic reviews is a little bit nuanced there. So you're picking up on one of those nuances. We take sort of a public health view of disease status. And so we're looking at prevention of disease. And so to that end, the criteria specify that we'll include studies that are conducted in populations that are either healthy or at risk of disease, or include a mix of people that are sort of reflective of the general population. So that might include some people with the disease, but also include some healthy or at risk as well. But what that ultimately means is that we have excluded studies that exclusively enroll a population that's been diagnosed with the disease, sort of with the aim of treating that population, because we sort of view that as more through a clinical treatment lens versus the public health lens. And so to that end, typically exclude those studies. The one nuance that comes into play there is when it comes to obesity. We did include studies with 100% population classified as obese for a range of different reviews, though we did exclude studies that were designed sort of to treat obesity specifically. So there's a little nuance there, and we're happy to answer more specific questions if you have them about particular reviews or particular populations and questions, but that's sort of the general essence of how we have applied criteria to try to capture more of a disease prevention, health promotion type evidence base.
So it sounds like quite a complicated search strategy. Esther.
Yeah, I did have one question. Could you elaborate a little bit more how you approach cardiovascular? Was it the same as obesity, or was obesity the only one where you included people that had the disease diagnosed?
Yeah, so when it came to cardiovascular disease, for example, if we were looking at a review about the relationship between diet and cardiovascular disease, we would have excluded studies that exclusively enrolled a population who had a history of MI or had a history of stroke. And the intention was to prevent future reoccurrence of an MI or a stroke. We would also have excluded studies that looked at treating somebody with high cholesterol or high blood pressure or hypertension. But we would have included studies that were in a higher risk population or in a population of 100% obese individuals. So it sort of depended on whether the study was looking at a endpoint health outcome versus an intermediate outcome when it comes to cardiovascular disease. So that is another sort of layer, at least with the cardiovascular disease literature, that you may sort of be picking up on as well.
You're considering hyperlipidemia as an intermediate or an end outcome?
Intermediate outcome.
Intermediate, okay. So those would have been included then?
Correct.
Okay.
Particularly if the study was looking at prevention of stroke or CVD mortality or MI, some of those endpoint health outcomes. So that would be the high risk population. We were looking to prevent some of those endpoint cardiovascular disease.
And Jose, I know you've been doing some thinking in this area. Are there any additional questions to clarify?
Well, in fact, you asked already my question, because based on the selection criteria, that's what I saw, that populations that included only people with cardiovascular diseases were excluded. But you mentioned two outcomes, which is MI and stroke. However, cardiovascular disease is much more complex than that. And then you are walking in a very gray area in terms of the selection criteria.
And we do have a much longer list of endpoint outcomes that we do look at for cardiovascular disease. Those are the two that are coming to mind, because typically those are the ones that we see pop up in the literature in terms of enrolling a population where you're looking more at secondary prevention.
Yeah, because the yes, problem that we have is that these are the dietary guidelines for Americans, but we know, and you go to the American Heart Association website, and the statistic is that 48% of Americans have one type of another of type of cardiovascular disease. So that immediately kind of bias the recommendations to just the other 50%.
Yeah, and this is Janet De Jesus. I'd like to add a point to that. So we have to be quite careful not to dip into the area of clinical guidelines. I mean, I come from the world of clinical guidelines. I'm from NHLBI, NIH, and it's a very, it's a different process. I mean, working with MDs and looking at pharmacological therapy and all the issues related, not only diet. So we do have to walk a fine line. We do understand that Americans, in the high percentage of Americans with risk factors and disease. So currently, we just can't get into that clinical area.
So you're telling us you have internally a pretty strong wall.
Yes.
Kathy Ross?
Yes, so thank you for this clarification. What I'm wondering is, getting back to the theme of transparency, is this explained someplace? Do we have internal or peer-reviewed documentation as to what is the process for exclusion? How are you applying it when you're doing the reviews? Thank you.
That's a great question. And in the response we provided, there are links to some of the places where we did discuss both sort of in real time during the committee's work, but also in the published scientific report of the committee. I will say this is a criteria that NESR has generally applied since our inception, a little over 10 years or 12 years ago at this point, but So it's a criteria that has been used consistently in our reviews over time. But when it came to the 2020 committee, we had the opportunity to present that criteria at a few of the public meetings. So you have links to the slides and videos from those public meetings. And then Barbara Schneeman, the chair, took the opportunity to reiterate that criteria at every public meeting because it was one that is a little bit confusing and we did get a number of questions on. So I think that we really tried to make that very clear throughout the process, and hopefully you'll see that in the videos and slides that are linked in the materials we provided.
And I'll just add, if there's a specific, Dr. Myers, you asked about cardiovascular disease. You can go to NESR's website, nesr.usda.gov, and look at the individual systematic reviews for specific questions and see how a criteria was applied for a specific question. So you can kind of do a case study or, an example. I think what we provided is kind of the high level, but you can see it operationalized within the individual questions on NESR's website. And it'll identify the specific criteria for that question, but also the list of included and excluded articles and the excluded articles and the rationale for exclusion. I'll note, and it's stated on the website too, that there's the rationale that's provided is that kind of the first one that was identified. So it's not potentially every reason why that article was excluded, but if you want to look at a specific question as an example, in addition to kind of the big picture description that's provided in the report, that's available on the website.
Yeah, and we have found those. Thank you. But I think the general description is what we were looking for. Thank you.
Okay.
Yeah, and I was just going to add to that, in the prepared material that we sent, there is a general description copied out into that document. So if you look at starting at page 2, it describes how health status of the participants was included in the systematic reviews. So
however, it was nice to have it repeated slowly with emphasis so that we got the nuance.
Sure.
In question 2, we also asked if the committee could obtain the public comments submitted by the DGA process. And it appears that you have provided a rather extensive list of what was available. Are there any further questions about that from the committee?
I think the question was also, what was the response that was taken based on those comments? In particular, for example, there were public comment period on the search strategies for the different systematic reviews. But is there a way, do we know what actions were taken based on those? Is that documented somewhere?
There's not a formal response around the public comments that are submitted through this process. For some federal processes, responses are required, but the departments and the committee do not respond to specific comments through this process. There might be some, I can say for all of the public comments, those were reviewed by the staff and the committee and discussed within the subcommittee discussions. We might be able to pull together some examples of how, comments that were received and how those were addressed, but there's not like a formal response mechanism that either the committee or the departments went through.
I think maybe I was asking more, maybe a better way to ask the question is the requirement for protocols would be that there would be, if there was an amendment to the protocol, that somewhere it's identified. So is there a process where you've identified what amendment was made to the search protocol, and then we could look at that? We wouldn't know where it came from, but we would know that there was an amendment, right?
Yeah.
Yes, that's true. And throughout the process of the 2020 committee's work, we did post protocols to the website,
Right.
and they were updated periodically with a new protocol put on the website with notes about what changes had occurred. When website transitioned to the Dietary Guidelines website, that sort of historical record of protocols isn't there any longer. Though when the committee drafted their report, they took care in their each subcommittee's respective chapter to discuss some of the major changes that had occurred to protocols during the course of their work with the rationale. Not every single small change that occurred to a protocol is captured there, but some of the major changes that occurred to, say, the list of outcomes or a population or something that was a pretty big change that had occurred during the course of the work is reflected in the subcommittee's respective chapter.
So in order to find those, we would have to open each report and go to that. There's a specific section that they're included, or are they sprinkled throughout?
It's in the committee's scientific report. Each chapter respectively has its methodology section, and that section includes some example or some whatever changes may have occurred that the committee wanted to make sure people were aware of. So we're happy to kind of give you some more direct links to those so you can be sure to know exactly where they are.
Thank you.
And the ones we're most particularly interested in are the ones that we need to respond to task 2 that relates to chronic diseases. Is that not correct, Esther?
That's correct.
Okay. All righty. So now let's move on to question 3 that relates to process. Process and methodology for the systematic reviews. And you've provided us some overall information, and then we had some more specific questions about how the reviews were updated, and you've just told us how that was documented, and it seems to have been coming from the DGAC, from the NESR staff, from public comments. Were there other sources that you used that caused you to update the protocols for the systematic reviews?
No, those were the major inputs that resulted in changes to the protocols themselves. I think my interpretation of this question 3A, how are existing systematic reviews updated, was more around the methodology that was used to, say, update a review that was existing that had been conducted by a previous technical expert collaborative or a previous dietary guidelines advisory committee.
Yes,
and
that's correct.
So there is a section in the methodology component of the scientific report that speaks specifically to the methods that were used for updating a review by the 2020 committee. So that's the link that's provided there.
Okay.
So could I?
Go ahead, Esther.
Sorry. So in particular, the previous report had recommended that there were probably 3 different kinds of ways to update things. Was that methodology was not necessarily mentioned in the short section on updating. So it didn't describe whether or not it was that you used the same search strategy, it was the same question, same search strategy, and you just looked at new research, or whether or not it was a situation where you had to change your search strategy or and then kind of redo the systematic review, or whether it was one that you had to go back and basically change some of the outcomes and methodology. There was like 3 different ways that they were thinking about describing the proposed methodology for updating.
So,
yeah,
go ahead, Julie.
I was just going to note that I would say that the vast majority of the reviews were updating using the first strategy. So
Okay.
essentially, it was the existing question and literature search strategy that were effectively just rerun and updated.
Okay.
For example, dietary patterns in cancer was done by the 2015 committee and then again by 2020, and virtually the same literature search strategy, the same protocol was used. It was purely just an update of the evidence for that review. Some of the other questions that were updated might have used slightly different approaches. For example, there were some 2015 reviews that were updated, but the starting point was not always just a NASER systematic review. So we couldn't just replicate our methods going forward, but it was more of a kind of building on what the 2015 committee had reviewed, and to the best of our ability, replicating what was done, but making sure it was just following our kind of standard protocols and procedures for the update. So dietary fat would be an example. Dietary fat and cardiovascular disease would be an example of that kind of scenario.
Okay, so let me ask one question, and maybe there was one of the reports said that there have been previous reviews had addressed these 6 questions, but the current committee wanted to address 4 questions. And so they said they used the existing review, but then it looks like they published their own review of those 4 questions. So it's not clear how they used the 6 questions that they said that they used. And I think this is in the dietary factors or the birth to 24. I'm not quite sure which. So in a situation like that, how is it described that they used the existing reviews, but then they published their own?
I think I would want to look at that particular scenario before giving a direct answer. I do know that in some of the human milk reviews, for example, they really parsed out the exposure of human milk in the PB24 project, where they did individual systematic reviews looking at frequency of human milk consumption, duration of human milk consumption, and really parsed it out. And so there may have been 6 questions on human milk consumption and an outcome. And then when it moved into the 2020 topic and question phase, some of those reviews were sort of subsumed onto one umbrella question. So it's the same question capturing the same exposure, but just the question is worded a little bit differently, more of an umbrella question than to sort of isolate very specific elements of human milk consumption.
Okay. Thank you.
Emily, did you have a question?
I just wanted to, so Esther asked part of my question, but just to be clear, like there's a lot of talk about timely and relevant as criteria for reviews. And from what I can understand, that just timely means whatever the DGAC defines as timely. So like if the DGA says we're going to look at this year range, then that's timely for that search. Is that accurate?
Yes, yeah. And that did happen with some of the PB24 work where they had the review and they did recognize that the search was maybe 2 years, quote unquote, out of date, but ultimately decided that because the existing review encompassed more than 40 years worth of research, that spending their time to update 2 years worth was maybe not the best use of time. And so they focused on conducting some of the new reviews that maybe hadn't been done in PB24. Mm-hmm. So it was a pretty thoughtful discussion that the subcommittees would have around whether or not they felt like were there kind of seminal papers released in the last 2 years that they really wanted to make sure were captured because they felt like it might change the landscape or the conclusion and grade. But I think in almost all cases, they ultimately felt like they were recent enough to have captured the vast majority of evidence on some of those B24 topics. And so they chose to sort of just use them as is and not update for their purposes.
So if you sort of were to list all the systematic reviews that were used to inform the 2020 guidelines, each one of them would have a just slightly different date range, right? Because some of them were up to 2015 and some of them were more recent, but not quite up to the 2020 committee dates.
Correct. Yes, there are some slight differences depending on when that original search was run.
And relevant was also in the judgment of the committee, right?
Correct. Yes.
Okay. Other questions from the committee before we move on?
The one last question was if methods had changed, like for example, determining risk of bias originally was done with the BAT technology and then it was used to a new instrument. If you use that existing systematic review, did someone go back and reevaluate and apply the new criteria to it so you had an updated risk of bias for all those studies?
No, we have not done that to date. The NEL bias assessment tool was the tool we used, for example, in the PB24 project or the 2015 dietary guidelines. Since then, we have updated to use some of the Cochrane risk of bias tools, and then a risk of bias for nutrition observational studies tool that we developed. There is a lot of similarity in the tools we currently use to the types of bias that were captured in the NEL bias assessment tool. So we felt like the bias assessments that were done had effectively captured the same types of bias we would capture going forward. And so we opted not to spend the time updating those. However, I would say that if there was a bigger change in the tool or the types of bias, then we would certainly definitely have considered going back to capture that. But in this case, we felt like there was enough sort of parallelness between the tools that it was okay to keep them as is.
Okay, thank you.
Sure.
Another question was, how were the 2015 systematic reviews used in the process? And you've given us a detailed list of some of these. And I'm going to stop there and take two questions. First from John.
Thanks. I'll just say, Julie, a lot of your processes remind me a bit of what the U.S. Preventive Services Task Force in ARC does. One of the things I'm a little less clear about in the updating process, is there a re-examining, well, a few things. Is there a re-examination of the questions and the priority setting? You know, for example, has the analytic framework changed? And as a consequence, now I heard you say that sometimes there's a combining of multiple questions into one, but and then if you don't mind, the follow-up question to that is there a re-examination of the studies that were included in the prior systematic review meta-analysis to see whether or not they are still fit for the purpose of the review, or are you just taking what was done and then tacking on what's new?
Yeah, and I think what you're getting to is really that assessment of relevance that's done as that initial step, where the committee would take a look at the protocol that was used by the prior expert group to make sure that they agreed that the inclusion-exclusion criteria that they applied, the analytic framework, the literature search strategy was comprehensive and what they feel would have been a relevant way to address the question. And in the vast majority of the reviews, if not all of the reviews, I think they felt pretty strongly that the protocol that had been applied in the existing review was essentially the same protocol that they would apply in an update. And so luckily we were able to essentially, in almost all cases, just replicate that initial review. The one place where there were some changes occasionally made were in our analytic frameworks. We identify key confounders and other factors to be considered. And those do get taken into consideration both during the risk of bias assessment and the synthesis process. And so sometimes the committee would come in and maybe tighten up that list of key confounders or add a key confounder and other factor to be considered. But I think that was virtually the only changes that did occur in the protocols as they were updated.
Can I just ask one quick follow-up question, Julie?
Of course.
It's the expert panel that's reviewing the criteria.
Correct.
Does the group that did the systematic review or doing the updating of the systematic review, do they go back and re-examine the studies based on the criteria to see if they agree with the original assignment? So the Preventive Services Task Force separates that, where you have the quote experts, and then you have your systematic review group, and the systematic review group will go back as an update, for example, and sometimes end up excluding or including other studies that the original systematic review group had, again, included or excluded, but they've flipped the decision making.
No, we have not had that scenario play out. I mean, our team are the ones that did the original reviews because we were using existing NASEM reviews in all cases. And so to that end, we, it was kind of our team that did the original reviews. And so we, I think, felt pretty confident that the criteria as they were applied were accurate. And so we hadn't changed anything. The one caveat to that is that when we do update a review, we do always make sure to go look at the included article list and just make sure that anything that was originally included hasn't subsequently been retracted or had some sort of update made to the manuscript, just to be sure that, you know, there wasn't something included that now is flawed or, you know, retracted that we would then want to remove from the review. I can think of one case where that has happened, where the paper wasn't actually retracted, but there were some questions about the randomization that had occurred in the trial. And so when we did go back and update that review, we made sure to note kind of some of the subsequent methodological publications that had come out on this particular randomized control trial and account for those concerns with randomization in the subsequent update. Thank you.
Sure. Stephanie?
Yeah, I guess this is a question for Julie as well. Sorry, Julie. I was not clear on the tools used for the risk of bias. And I think you've clarified that there were a number of different ones, but you feel they are fairly comparable. But the other was the tool used for grading the evidence and who did that. In some places, I understand it was the DGAC. Was that consistently the DGAC that did the grading, and was it consistently the same grading tool?
Yes. In our process, when we work with an expert group, it is the responsibility of the expert group to do the synthesis and development of the conclusion statement and then grading of the strength of the evidence. Our team helps facilitate that process, but it is ultimately the responsibility of the expert group to use our grading tool in assigning that grade to the conclusion statement that they have developed based on the synthesis of the evidence. And in all cases, the same grading tool was used, and it was always the subcommittee and the committee that did the actual grading of the evidence.
And what was the tool? What was the grading tool? Because there are several.
Yes, yes. So NASEM has our own grading methodology and criteria that we use. We've always had our own grading process since our inception. And then between projects, we've always spent time as part of our continuous quality advancement initiative, reviewing our tool and looking at what is happening in the field. You may notice in the 2017 NASEM report, they actually had some recommendations around the grading process that we really closely looked at. They recommended we take a look at the grade methodology, the ARC methodology, and then make some decisions about how to update our own process or adopt a different method. And so we did that work prior to working with the 2020 committee and made some updates to our process. We align very closely with the grade methodology, though we do differentiate on a few points. But in general, the criteria are very similar.
Okay, I was on that committee, and therefore that's the reason for my questions.
Yes.
Yeah. Okay.
So, and thanks. Yeah, and there are a few presentations that speak to that specifically, and we're happy to give you links to those slides and presentations as well, because the committee had some questions about that as well.
Okay, thanks very much, Julie.
Sure. I think we would like to receive those if possible, Julie. All righty. Okay, I'm going to stop here at the end of question 3. Is there anything else on the first 3 questions before we move on to 4? So we've gotten a lot of new information so far. So the next question is about the peer review process for the systematic reviews. And The specific questions were things like, was there a defined methodology for peer reviews? How were the reviewers chosen? How were the reviews assigned to them? Did they each see all of them or just a subset? Is the review process published, and what were the specifications for the review process? And you have provided us with a link to the DGAC report. Is there anything else that you think the committee might need to know about this process?
I think that section of the methodology really hits every one of your questions when it came to peer review. So I don't think there's too much to add other than that it was a blinded process that followed a procedure that is very standard in a peer-reviewed journal. And it was coordinated by David Klerfeld from the Agricultural Research Service.
Questions from the committee about that? Emily.
So I saw somewhere that the search strategy is internally peer reviewed, right? Is it also externally peer reviewed or just internally?
It is just internally peer reviewed. We have a full-time NASER librarian on staff, and then we collaborate with the National Library of Medicine at NIH has a librarian, and she does a peer review process of the literature search strategies. That said, when we did send the reviews for peer review, through the process that's outlined in the methodology section of the report, that was one of the things we said, please make, take a look at the literature search strategy and make sure that it's comprehensive. And that was also something that was available as part of the protocols that were posted publicly. If someone wanted to see the literature search strategy, that was available, and we would have taken comments on it as well.
Okay, thank you. Stephanie.
Just a little more clarification on the peer review. I think I read that they were all federal employees who were the peer reviewers, weren't external scientists. And my question is, how were they, on what basis were they selected? Is it their expertise in systematic reviews or their content expertise?
I'll answer to the best of my ability. We were not part of the process of selecting the peer reviewers, but my understanding is that they were mainly based on their expertise in the topic areas of interest, and they self-selected which topic areas they felt that they were equipped to thoroughly peer review a systematic review on. I'm not sure that any of them or many of them were experts in systematic review methodology specifically. I think they were more nutrition scientists who are employed by various federal agencies.
Okay, thank you.
Okay, well, we will read that carefully. Martha.
Hi, I have just a quick one looking at the methodology in page 45 and 46. So it says that the peer review occurred after the draft conclusion statements and then updates were made. Can you clarify that a little bit, and also how the decisions were made, or how the NASER staff made the decisions about which comments to take to the subcommittee? How did they decide what was substantive and not substantive?
Sure. So we gave the peer reviewers the systematic review once it had the conclusion statement and grade, because we felt it was important that as part of the peer review, they, take a look at that conclusion statement and grade and make sure that they felt that the conclusion was accurate to the evidence underlying it, and that the grade or the strength of the grade, was justified. So that was why we kind of gave that draft once a conclusion statement had been drafted and presented at a public meeting and vetted by the committee. We virtually gave almost every comment, I think, to the subcommittees. Some of the comments were things like, there's a typo here, there's, you're missing a period, or something of that nature. But anything that had anything to do with content or the science, we gave fully to the subcommittees.
Thank you.
All righty. More questions on this subject?
I just have
Yes.
just one question. So in a peer review process, there would also be feedback in terms of how it was addressed. Was that included anywhere in the process? You know, a peer review, you submit your comments, the authors have a chance to explain either why they did or didn't, and if they made changes or whatever. Is that sort of documentation part of this peer review process?
Yes, in every case, the subcommittee with necessary support drafted responses to the peer reviewer comments and did send. We gave them to Dave Clearfield, who then sent them, since we weren't aware of the peer reviewers, but he did send them back to the peer reviewers with their responses. They were not published anywhere, those responses, but they were provided to the peer reviewers with rationale for what was taken and what wasn't.
Would it be possible for us to see an example of what that looked like?
Sure.
Okay, that might be helpful. It sounds like there's a more extensive process than I was aware of. And it sounds like the blinding was effective. Okay. The next question is about food pattern modeling. And we were interested both in what the process was and the scientists involved and how the contributions were of the various kinds of food pattern modeling were used together. And you have referred us to the same methodology section of the DGAC report and a video for this. So in food pattern, can you give us a little bit more information about what kind of food pattern modeling you're doing sort of more generally, and how you're linking or not linking what people are eating to the food supply?
So I'll just start off by saying Julie led up our NESR systematic review work for the 2020 committee. Dr. Teresa Rebecca Panucci led up our food pattern modeling activities for the 2020 committee, and she is on the beach. So she was not able to join us today. She was on leave this week, and we did not call her and ask her to join. But so I can kind of speak to this, but I will also, if there's a lot of in-depth conversation y'all want to have about this, we'd be happy to, facilitate some additional discussion with her who can speak to it really well.
I think we will be asking for that, but go on.
So I will just note one thing in particular around, so we have there is a write-up in the report. I looked at it again today, and I really refer y'all to the supplementary information that is also linked in that response. Mm-hmm. If you look at that supplementary information, it provides a lot more detail. So it really gets into the methods, kind of the step-by-step methodology. It does include information from NHANES. So it does, to your question about does it reflect current consumption, it includes information from NHANES to inform the nutrient profiles that are included in the food pattern modeling activities and considers current consumption. So this was the first time that we did do food pattern modeling activities for 6 to 24 months. And that is also published in a separate publication. Mm-hmm. And we didn't include that here, I'm realizing, but we can send that reference separately.
This is the Kay Dewey paper in the journal.
Exactly.
We have found that.
Okay. Yeah, so that's the kind of the 6 to 24 month additional analyses that were done. So I'll say I really refer to that supplementary info. There are some other publications from previous, we started food pattern modeling in 2005, and it's kind of evolved over time. One of the things in particular, kind of in response to the NASEM recommendation, was around kind of expanding that, because there is a range of dietary intake. And one of the things that was done this round when forming nutrient profiles that are used in food pattern modeling, historically, we looked at NHANES for 2 years and older. And for this round, we did nutrient profiles that were by life stage to kind of reflect the variation in consumption at different, that we see at different stages of life. So there was some work done in food pattern modeling to kind of reflect variability in current consumptions. Mm-hmm. But if there are specific questions, we're happy to add those to the list and do some additional follow-up in the next week or so.
But the real challenge here is pregnant and lactating women for whom there are very, very few individuals in the NHANES data set.
Absolutely.
Was there anything special done to deal with that? And you don't know what stage of lactation they're in. You don't know how pregnant they are. Those are stages of life in which we say dietary intake should change. So what was done to handle that, if anything?
Janet, I see you came off mute, so I don't know if you are going to add something, but I will say there wasn't, I mean, food pattern modeling was done for pregnancy and lactation, but there wasn't necessarily, the committee acknowledged that challenge in the NHANES, and that's a research recommendation that's highlighted by the committee. Mm-hmm. So it's definitely a limitation and was discussed by the committee. But Janet, did you want to add something as well?
Yeah, I was just going to agree with you. You know, we're at the mercy of the data available, and that I believe, you know, we worked the committee and, you know, federal staffs supporting the committee worked very closely with NHANES staff and also NCI staff and NIH, who help, you know, with the nutrient intake data, you know, to look to see, you know, the population numbers in NHANES, if there was enough for power. So in some cases, you know, different years of NHANES were combined. So, and that's all documented in the report. But yes, we agree with you. We have federal coalitions, you know, trying to get more data in these populations, pregnancy, lactation, and birth to 24.
Yes, okay. Other questions about food pattern modeling at this stage? I'm going to take one from Bruce.
Yes, hi. So I think one of the thoughts with the food panel modeling recommendation was also how will that tie in with the recommendations, the other recommendations like the system science recommendation, as well as the recommendation to establish continuity between the different DJAs. And I understand that given limited time, there's only so much that could be done to integrate those things, but were there plans discussed on how to proceed on the food pattern modeling, like what would be the next steps and any timelines in terms of further developing those things?
Yes, I'll say just as a high level comment to start off that we took the NASEM reports, and to us, 2020 is kind of the beginning. So, you know, we're looking at, this is a process that we do every 5 years, and how do we continue to evolve in consideration of the NASEM recommendations, as well as other best practices and things that are happening in guidance development. So yes, we have plans to continue to explore and evolve food pattern modeling. As well as the recommendation around systems. And I'll say several of us were on the webinar that you were a part of yesterday, so which was excellent, some great presentations there. So for us, I think it's, I think the recommendation from the NASEM committee was to commission research to continue to explore that. I'll say our specific CMPP for USDA and ODPHP for Janet's office for HHS, we don't commission research specifically. We do work with other groups that do, but we have been exploring opportunities to have, we think we need an expert group, a group to get together to talk about how do we integrate this into the dietary guidelines process. You know, there's using these different methodologies for implementation or other pieces, but specifically for the guidelines process. So we have done a couple of rounds of trying to get funding to support some of that work, and we will continue to do that. But so yes, for this round, it was a bit timeline, but also needing to do the research to understand how we would integrate those methodologies to support guideline development.
Okay.
Sharon, go ahead.
Thank you. And that actually answered some of my questions, but I guess I would just also ask maybe in the follow-up from Tusa Rebecca, if you're able to provide information on whether there was consideration of some of the nuances in the NASEM report, so around like the food groupings and dairy versus other sources of calcium, the way some of the protein foods are combined, and then also the focus on the nutrient dense foods, whereas we know that's not what most folks are consuming. And so, yeah, if you are able to provide any information on how those were addressed or that they weren't, that would be helpful too.
Yes, and I can say that continues to be a conversation, how best to group, how to handle things that protein, for example, protein foods, you get protein from other foods other than just the protein foods. So that is part of the conversation. I think that is an area that we'll continue to look into. But yes, we can, and I will say there was an activity done by the 2020 committee and also the 2010 committee that the modeling is based on nutrient dense, but there was a typical choices analysis that was also done that kind of put it like, if we consider what people typically eat versus selecting the most nutrient dense representative food, what do the patterns look like? So that was another analysis that was done for both 2010. There was also a publication associated with it, but it was done in 2020 as well. But yes, we can provide more about that though in our response.
Okay, thank you. I think it's the Dewey paper mentions optimization models as well. And so maybe that's something else you're thinking about going forward, but that wasn't done for 2020. Is that right?
Correct. It was discussed. I mean, we've certainly discussed optimization models in different methodologies, but correct, we did not pursue that for this round.
Thank you.
Bruce, back to you.
Just a quick question. So my understanding is the modeling that's been done has been more sort of top-down modeling, sort of looking at the patterns of, as opposed to systems models, or maybe if that could be specified in terms of the type of modeling that has been done.
You're correct, and yes, we can.
Okay, great, thanks.
Any other questions about this topic? All right, let's move on to question 6, which is broadly about how the federal agencies identify when new evidence is needed for a DGA topic. And the specific questions related what tools were in place for doing this, and you have given us a link to the methodology for this. And we also asked about when do data need to be analyzed in innovative ways to prepare for a DGA review, and how do the agencies decide when a new methodology is needed. And the last 2 of those, you told us you would respond separately. Is there anything you'd like to say about that at this point?
I guess, and I don't know, I think for these questions were a little bit less clear to exactly what y'all are getting at. If you wouldn't, I mean, I don't know if y'all have, or could y'all just take a minute and kind of speak a little bit as to exactly what you're trying to get at with these, just to make sure we're giving you what you want.
So I think this relates to the food pattern, both the food pattern modeling and the system science. These are newer methodologies that some of which you have been working at for a long time, but there are new versions of that available. And there also might be innovative ways to combine, let's say, for example, the food pattern modeling and system science. So it's less about those specifically, but that's where the question comes from, those recommendations, but it's less about that specifically than what's the federal strategy for integrating new methodologies in a process like the DGAs. And partially that's trying to get a sense for how expensive this is to do, how disruptive it is the kinds of people who might have to be trained to do it? Or is it just part of your quality improvement project and it's going to happen anyway and we don't have to worry about it? Does that help? And if any of my colleagues would like to correct me or say something else about it, please chime in. Bruce.
Yeah, I think part of it is what systems will be in place for like reviewing the new things that may emerge, especially since we anticipate, in the coming years, there's going to be all kinds of things emerging in terms of different types of AI, for instance, approaches. Is there a process in which, these, there's a list of these things that then will go through a certain set of steps to determine whether they should be adopted into the process, and then what might that procedure be, and who might be involved in that, et cetera. Basically, is there some type of system that will do that?
Yeah, I think we can, I don't, Janet or Julie, do y'all have any follow-up questions about the intent? I think, thanks for that. That makes sense. And it might be that, or, we have some examples of when we have integrated new methodologies. So 2005, we integrated food pattern modeling. 2010, we started our systematic review work. So maybe we use those as a little bit of a case study and some of the infrastructure we have in place. So we can follow up with that.
Okay. So the report, the 2017 report, has lots of ideas of ways to go into the future, and of course, some of those are things that are not possible for you to do, but in some ways we're trying to explore what that might look like. I'm going to go to Kathy first, and then Esther.
Thank you. So my question kind of follows up on that. So, one of our questions has to do with, well, if things weren't done, what would it have taken in terms of manpower or cost to achieve that? And I just wonder, do you have any internal documents or white papers or discussion papers about what it would take to implement the systems approach more into the research that you're doing? We realize that it's new and you might not have done all that already, but is there anything that we would have access to about future considerations?
I think what we've done to date around that is more around requesting, like how we would propose initiating and looking into it. So we have had some conversations around that, and I mean, we could certainly share kind of where we're going, or how we think we could pursue looking into this as a methodology. So it's not extensive, but yes, I think we can have, give a response that kind of speaks to how we would approach, how we plan to approach it.
Right, and we're interested in the process here and in understanding what the advantages and disadvantages you might have in doing this as a federal agency. Esther.
So following up on Bruce's question about the documentation for how you consider things. One of the recommendations from the past report was that there be a continuous improvement program. And so could you describe broadly how that happens? Is there a specific council that looks at it? Do you meet quarterly? Do you gather input from specific places? Is there anywhere that's documented when you made changes? And now I'm talking about specifically changes to the systematic review process, when you made changes or what things you considered or anything like that could serve to illustrate how you have implemented a continuous improvement program in a systematic way that addresses keeping your systematic review process aligned with best practice.
Yeah, and I think we do have a little bit of content on our website that speaks to our CQA, what we call CQA, continuous quality advancement efforts. But to date, we haven't published a more extensive sort of overview or process of how we go about doing that. But I think in a way, it's probably time to do that because we have a pretty extensive CQA effort that is kind of underway now, but we've done it in between every project we've ever done between 2010 and some dietary patterns work after 2015, after PB24. And so we have a really long history of doing this work, but we have sort of sold ourselves short, I think, in actually putting it out there more specifically. I think if you look methodology to methodology, you might see some of those changes over time, but there's a lot that goes into it. So we can certainly prepare a more in-depth response that gives you more insight into what our team does on that front from a systematic review perspective anyway.
Because sometimes it looks like there's a fuller description now where it wasn't described before. So it's not clear whether that was a change in the process or you just put on paper what you'd been currently doing. So it's kind of hard for us to determine what was actually a change and what was just a better description of it.
Yeah.
And then the other question there was a recommendation about ongoing surveillance of the literature for systematic reviews. And maybe it's there, but I missed seeing what that description looks like. Do you run it every year? Do you save the sources in PubMed? I mean, what is the process for doing the ongoing surveillance of the existing systematic reviews?
Yeah, that's a huge topic that we're embarking on doing more efforts on. And I think we can probably share a little bit more in that space because it was part of the 2017 NASEM report, but it was also a recommendation that the 2020 committee had in some of their future directions in their scientific report. I think in previous iterations, 2010 to 2015 to 2020, there were quite a bit of change in terms of the topics and questions being addressed. So we never quite knew which topics or questions might be carried forward to the next iteration. But I think now that we've settled in and NASER has been a part of the process for a little bit longer now, we're in a better place to be able to predict what we can and should be monitoring over time. And so we're really looking closely into a process for monitoring some really high priority areas on a monthly basis going forward, because we know that the publication rate in some of these topic areas is really huge, and to try to update it every 5 years is just a huge undertaking. And so we've been doing a lot of work to think about how we can kind of more continuously be monitoring the evidence. And I think we can certainly share more in that space because it's something we're excited about.
Other questions on this subject? Okay. The next question is about barriers to addressing including systems modeling in the most recent version of the DGAs. And I think we have been alluding to this, but we're interested in what the barriers were and what your plans for addressing them are. And that is to be sent separately. Do you have questions for us about the clarity of that question? No, that one's pretty straightforward. And then the last one is similarly, what influenced decision-making about implementation of a continuous quality improvement strategy? And it seems for the systematic reviews, that's something that's been going on for a long time. What about the DGA process more generally? I mean, clearly there is more information needed on the systematic reviews, just as you've described, but for the DGAs more generally, clearly this last committee provided you with some research recommendations and other thoughts, and you've told us previously you do an after-action assessment at the end of the process. But what else? We're interested in knowing what else you've been doing and what has influenced your decision-making given what you found from these various processes.
I think that question is clear. I'll just say, similar to NASER, we have always done that as part of our process. And I think that has been a benefit of, it is a every 5 years, even though it's a continuous process. We only release the guidelines every 5 years, but it's a continuous process. And every round, we similarly look to continuous quality advancement, both by kind of working with our previous committee members, as well as staff that's been involved in the processes, following what's happening in international dietary guidance development, in the development of clinical practice guidelines, and the development of other recommendations, following those best practices. So I think we can, it has been it's literally, it's part of our day-to-day. So I think we can kind of I think we can follow up with a little bit more of a description as to how we approach that.
That would be helpful. Okay, that's the end of the questions we provided to our speakers in advance. I'm wondering if there's anything else the committee would like to ask in this open session.
So I have one follow-up question, and that was question about how you're aligning with the best practices for systematic reviews. What is your basis of kind of, what are you comparing yourself against when you're thinking you're aligning with best practices? Is it the IOM report? Is it a different government agency's review process, or what are you kind of using as your standard to identify that best practice and how you're evaluating against that?
Sure. Yeah, I think to your point, the IOM systematic review stands were a really big resource that we relied on over the years. In addition to that, we always look at what Cochrane is doing and follow along with what they do with their methodology. They recently published their new methodology and have added quite a bit, which is really nice as a resource. We also look at ARC, of course, as a kind of federal agency that addresses similar topics, though somewhat different. We've also been able to connect with some colleagues over in NIH and the National Institute of Environmental Health Sciences National Toxicology Program, as well as the Environmental Protection Agency, that do a lot of more toxicology reviews, but again, from a public health perspective, and have some really nice methodology. So I'd say those are some of the major ones, but we also look to the international space. There's a really active group in Scandinavia, as well as Australia, and at Health Canada, that do a lot of work that parallels what we do. So those are some of the things that we do monitor and align with to the extent possible. But of course, keeping in mind that we want to be able to tailor the methodology to our own unique purposes in the nutrition space.
Emily.
We talked a little bit about peer review of specific questions or procedures, but I'm just curious if NESR has an external review process just about the overall program, or how that oversight works. I just don't know much about it.
We haven't necessarily done a formal sort of systematic review methodologist peer review of our process. That was a recommendation that was part of the 2017 review, not only to sort of collaborate and engage with experts from other systematic review organizations, but to invite people to come in and review our methods. Obviously, I think we view this activity as one of those, as well as the 2017 process as well. And it's something I think we would like to do more of. We have done more of the collaboration and engagement with other methodologists and sort of bouncing ideas and making sure our approaches are sort of in line with where they were thinking their methods were and rationale and things like that. So it's not something we formally have done outside of these NASEM studies, but something I think to explore in the future.
Mm-hmm.
And I'll just add that NESR, federal staff and the committee have published several manuscripts, and all of those, go through a journal peer review process. So all of the PB24 and several recent manuscripts.
Mm-hmm. Mm-hmm.
I would just add on to Janet's comment. We are hopefully in the process of submitting some manuscripts about various aspects of our process to journals in the next month or two. So we're really kind of looking forward to that as being kind of in line with that recommendation to get peer review of elements of our process.
Mhm.
One last question about the peer review. There was a recommendation about publishing protocols in Prospero. Can you share with us your thoughts on that?
So with the 2020 process, we did not publish our protocols in Prospero, but we did publish them on dietaryguidelines.gov using a model that matched the Prospero model. So we looked at the elements that Prospero requires of their protocols and designed our protocols to kind of match or align with the types of elements that you would see in a Prospero protocol. And so that was the approach we did last time, was to use dietaryguidelines.gov instead of Prospero, so that it would all be housed in one central location.
Bruce.
And I guess inherent in all of these questions is also tying in with the recommendation of, how do subsequent DGAs build upon each other? It would be helpful in each of these cases to know, like, how do you what kind of systems are you planning, or have you discussed, how to set up systems where it's building upon the previous one as opposed to sort of doubling back and starting anew each cycle.
Okay. I don't see any more questions from the committee. Are there more questions from our guests, from USDA and DHHS? All right. I want to thank our federal guests sincerely for both the effort that you've put in to respond to our questions to date and for your discussion today. I felt we've had a good dialogue. We understand one another a little better in terms of what we're trying to do. We recognize how important this process is to you and how hard we have to work to understand both what the committee intended and what's been done. So we're working at it and we appreciate your assistance. And with that, this open session is adjourned.
Thank you.
Thank y'all.